They told you aging meant decline, but they were wrong. Because what they didn't tell you is that aging can mean freedom. Freedom from a noise. Freedom to live on your terms. Freedom to take care of your body, not out of fear, but out of respect. My name is Dr. Jake, and I've spent over 30 years helping men just like you. Men in their 60s, 70s, even 80s reclaim energy, strength, and yes, even intimacy. Not with prescriptions alone, but with clarity, confidence, and care. Let me ask you something. Have you ever felt like your body just isn't listening anymore? You try to stay active, but your energy dips. You still love your partner, but something feels missing in the bedroom. And maybe you're starting to wonder if it's just part of getting older. I want you to hear me clearly. Aging changes things, but it doesn't take away your power. And when it comes to your health, especially your manhood, there are real, practical steps you can take starting today. In this video, I'm going to walk you through 5 essential ways to care for your penis as you age, with respect, science, and simple tools. And yes, we'll even talk about 4 surprising fruits that have been shown to restore blood flow and enhance intimacy after 60. This is not about shame. This is not about being young again. This is about being you, strong, wise, and fully alive in the body you've earned. In my years as a urologist, I've worked with thousands of senior men. I've seen the doubts, the frustrations, but I've also seen the breakthroughs. When men learn how to support their hormones, improve blood flow, and protect their prostate, they don't just live longer. They live better. So whether you're here out of curiosity, concern, or quiet hope, stay with me. There are natural, affordable, and even enjoyable ways to take back control. And yes, they do work even in your 70s, 80s, and beyond. Before we dive in, do me a quick favor. If you care about your health and want more videos made for you, hit the subscribe button, tap the bell, and share this with a friend or brother who could use this message today. And if this helps you, just comment 1 below. If not, comment 0. I read every comment, and your feedback helps shape what I create next. And while you're there, tell me, what country are you watching from? Our community is growing all over the world, and I'd love to hear from you. All right, let's get started. Because growing older isn't a decline, it's a graduation. And your body still has a lot of life, strength, and pleasure left to give. Let's honor it together. Absolutely. Here's segment 1, Know Thyself. Why penile health still matters, 7 to 10 minutes. Continuing in the warm, respectful voice of Dr. Jake, with clear transitions and a dignified tone. Let's begin with the foundation of all health, awareness. You can't protect what you don't understand. And when it comes to your penis, most men were never really taught what's normal, what's not, or when to take action. But here's the truth. Your erectile health is not just about sex. It's actually one of the most reliable signals of your heart and vascular health. Yes, you heard that right. When blood stops flowing well down there, it's often a sign that it's not flowing well up here, to your heart, your brain, your organs. In fact, erectile dysfunction can show up years before a man is diagnosed with heart disease. So when we talk about penile health, we're not just talking about intimacy. We're talking about circulation, confidence, and whole body wellness. Now, let's be honest. Changes happen with age. The skin may thin. Erections may take longer or be less firm. These shifts are natural, but that doesn't mean they should be ignored. Because sometimes what feels like just aging is actually a correctable issue. Low testosterone, nerve damage, poor circulation, even certain medications, these can quietly erode your function, your desire, and even your confidence. And that brings me to this. Your mental and emotional health are deeply connected to your physical health. I've seen men carry shame or fear, thinking they've lost their manhood. But in reality, what they've lost is blood flow or hormonal balance or muscle tone. These things can be improved. So how do we take back control? Let me share a few practical, respectful steps you can start today. Practical tip 1, monthly self-check. Once a month, in private, take a moment to look at your penis and scrotum in the mirror. This isn't about criticism, it's about care. Look for any changes in size or shape, skin color or texture, lumps, bumps, or sores, any unusual discharge, swelling, or curvature. This takes less than 2 minutes, but it can help you catch early signs of infection, skin issues, or even cancer. And most importantly, it keeps you connected to your own body. Practical tip 2, start a journal. You don't have to write a novel. Just jot down quick notes when you notice things like lower libido, less frequent or weaker erections, pain or discomfort, changes in urination. This helps track patterns and give your doctor a clear picture if you ever need to bring it up. You don't have to remember everything. The journal does the remembering for you. Science Light, why these changes happen. Here's the biology in plain English. Erections are all about blood flow, and that flow is driven by healthy arteries and veins. As we age, those vessels can narrow or stiffen. This slows the flow, not just in the heart, but everywhere. At the same time, testosterone levels gradually decline. That's normal, but for some men, they drop too far, leading to fatigue, reduced interest in sex, and even mood changes. Add in nerve sensitivity, which can decrease over time, and you've got a perfect storm. But the storm isn't permanent. By taking small, consistent steps, you can improve blood flow, support your hormones, and restore not just your function, but your sense of confidence and control. Now, I know this isn't something we were taught to talk about. For many of us, this kind of conversation never happened with our fathers, our friends, or even our doctors. But let me remind you, there's nothing weak or shameful about knowing your body. In fact, it's one of the strongest things you can do. It's how you protect yourself. It's how you protect your relationship. It's how you protect your quality of life. So start simple. Take a look, take a note, and take pride in the fact that you're doing something most men never do. You're paying attention. In the next section, we'll dive into the one reason erectile health changes after 60 and how to restore blood flow naturally. Stay with me. This is where the solutions begin. Tip 1. Maintain blood flow like gold. Let's get to the heart of the matter, literally. If you take away just one thing from this video, let it be this. Your erections depend on blood flow, and blood flow is gold. Without healthy circulation, the penis simply can't function the way it used to. It's not a failure of desire, masculinity, or willpower. It's biology, and biology can be supported. Think of your blood vessels like garden hoses. When they're clean, flexible, and open, water flows easily. But when there's plaque, stiffness, or narrowing, flow slows down. Pressure builds up. Things stop working. This is exactly what happens in the body, especially after 60. Plaque buildup, high blood pressure, diabetes, and even long years of sitting too much. All of these can quietly reduce the blood supply to your penis. And since an erection relies on rapid blood inflow, it can make things frustrating, unpredictable, or even impossible. But the good news is this. You can improve circulation naturally, gently, and safely. It doesn't require intense exercise or expensive drugs. It starts with movement, food, and attention. Let's talk about what works. Practical tip 1. Walk daily. Even 10 minutes helps. One of the simplest ways to improve circulation is to move your legs. Yes, your legs. Why? Because the large muscles in your thighs and calves help pump blood back up to the heart. This improves overall flow, especially to the pelvic area. Start with a 10-minute daily walk. If you're more mobile, build up to 20 to 30 minutes. No fancy gym, no pressure, just movement. You can even walk inside your home, around the kitchen, down the hallway. Consistency beats intensity. Practical tip 2. Eat for nitric oxide. Nitric oxide is a natural chemical your body produces that helps dilate blood vessels, meaning it opens them up for better flow. As we age, we make less of it, but you can boost it with food. Try adding more of these to your diet. Beets, raw, roasted, or juiced. Spinach, arugula, and other leafy greens. Citrus fruits like oranges and lemons. Pomegranate juice in small amounts. These foods help your blood vessels relax, allowing more oxygen and nutrients to reach every part of the body. Yes, every part. And if you're on a specialized diet, talk with your doctor or nutritionist about options that fit your needs. Practical tip 3. Hydration and compression. Dehydration thickens the blood, making circulation sluggish. So make sure you're drinking plenty of water, especially in the morning and before light activity. If your legs swell or you sit for long periods, compression socks can help. They gently squeeze the veins, encouraging better upward blood flow. I've recommended them for years to patients with mild circulatory problems. They're safe, effective, and surprisingly comfortable. Natural supplements that support blood flow. Now let's talk about a couple of natural compounds that have shown promise. L-arginine and L-citrulline are amino acids that help increase nitric oxide levels in the body. Some studies show they may improve erection quality and blood flow, especially in men with mild to moderate issues. But a quick word of caution. These supplements can interact with medications, especially for blood pressure or heart conditions. So talk to your doctor first before adding anything new. This isn't about experimenting. It's about making informed, safe choices. Bonus tip, deep breathing for vascular relaxation. You may not think about breathing as part of blood flow, but it absolutely is. When you breathe deeply and slowly, you activate your parasympathetic nervous system, your rest and restore state. This helps your blood vessels relax, reducing pressure and allowing smoother circulation. Try this once a day. 1. Sit comfortably. 2. Breathe in slowly through your nose for 4 seconds. 3. Hold for 4 seconds. 4. Exhale slowly through your mouth for 6 seconds. 5. Repeat for 2 to 3 minutes. This doesn't just support circulation. It reduces anxiety, improves sleep, and can even help your heart. So remember this. Blood flow is life. It keeps your mind sharp, your muscles strong, your organs nourished, and yes, your penis healthy. You don't have to overhaul your life. Start with small changes. Walk a little more. Add a beat to your plate. Take a breath. Every step you take opens the pathway to better health. In our next segment, we'll talk about something every man over 60 should understand. Hormones. Yes, testosterone. Yes, aging. But also, how to naturally support the fire that still burns within you. Stick with me. You're doing something powerful, and I'm proud to be here with you. Absolutely, Rhiannon. Here's the continued script for Tip 2. Don't ignore hormones. Let's talk about something many men suspect, but few bring up with their doctor. Hormones. Yes, testosterone. That powerful little molecule that once gave you drive, muscle, energy, and, let's be honest, a spark in the bedroom. Now here's what happens with age. Starting in your 30s, testosterone begins to decline gradually, about 1% per year. But for some men, especially in their 60s and beyond, it can drop below the point where you feel like yourself. You may notice lower libido, difficulty maintaining erections, fatigue or loss of motivation, mild depression or emotional flatness, muscle loss or belly fat creeping in. Sound familiar? You're not alone. But here's the good news. You don't have to accept this as your new normal. You can support your hormones in ways that are safe, natural, and effective. Practical tip 1. Ask for a hormone panel. The first step is clarity. Ask your doctor for a full hormone panel, not just total testosterone, but also free testosterone, estrogen, estradiol, DHEA, SHBG, sex hormone, binding globulin. Why? Because total testosterone doesn't tell the whole story. You want to know what's available and active in your body. Don't wait until things get worse. Get a baseline. Knowledge is power. Practical tip 2. Strength training and protein. Here's a free way to raise testosterone naturally. Lift something heavy. You don't need a gym. Push-ups, squats holding a soup can, resistance bands. Even 2 sessions a week of light strength training can stimulate testosterone production and preserve muscle. Pair it with protein-rich meals like eggs, beef, poultry, or legumes. Your body needs amino acids to build hormones and keep metabolism active. Practical tip 3. Protect your sleep. Most testosterone is made while you sleep, especially during deep REM sleep. So if you're getting less than 7 hours a night, your hormones could be taking a hit. Try this. Set a regular bedtime. Keep your room cool and dark. Avoid screens and caffeine at least 2 hours before bed. Better sleep equals better testosterone equals better mood, energy, and intimacy. Now, let me be clear. This isn't about vanity. It's about vitality. It's about waking up with energy, moving through your day with strength, and feeling connected to your body and your partner. You still have fuel in the tank. You just need to stoke the fire. In our next segment, we'll look at something even more basic, but just as important: cleanliness and skincare. Because good hygiene isn't just about looking good. It's about feeling good and preventing problems before they start. Tip 3. Cleanliness and skincare. Let's talk about the part no one ever taught us how to care for: the skin down there. As we age, the skin on the penis and scrotum becomes thinner, drier, and more sensitive. This makes it more prone to irritation, fungal infections, and even conditions like phimosis, a tightening of the foreskin that can cause discomfort or hygiene issues. But here's the good news. A simple, gentle routine can keep things healthy, comfortable, and clean. Practical tip 1. Gentle soap always. Use a mild, unscented soap, preferably something formulated for sensitive skin. Avoid heavily perfumed body washes or harsh scrubs. Warm water and gentle hands are all you need. If you're uncircumcised, gently retract the foreskin and rinse underneath, then dry completely. Practical tip 2. Dry carefully. Moisture is the enemy of healthy skin in warm, enclosed areas. After your shower, pat dry the entire area with a clean towel, including underneath the foreskin if present. Never rub roughly. And if you tend to sweat or experience chafing, consider breathable underwear or moisture-wicking fabrics. Practical tip 3. Don't ignore rashes, redness, or pain. Many men ignore early signs of irritation or infection, hoping it will just go away. But early treatment is faster, easier, and less stressful than waiting. If you notice itching, flaky skin, burning, redness, or swelling, tightening of the foreskin, don't self-diagnose. Get checked. Most issues like yeast infections or dermatitis are very treatable. Natural skin solutions. Check with your doctor first. Here are some gentle, natural options that can support skin health. Coconut oil, naturally antimicrobial and moisturizing. Apply a small amount after drying. Calendula or chamomile creams. These can soothe irritation, especially if your skin is prone to inflammation. Look for products made for sensitive skin. Always do a patch test first, and avoid applying anything internally unless directed by your doctor. Cleanliness is not about being obsessive. It's about respect for your body, for your comfort, for your dignity. When you take care of your skin, you reduce odor, itching, discomfort, and you build confidence. In the next segment, we'll explore something most men don't think about until it becomes a problem: the prostate. What it does, why it matters, and how to keep it healthy without fear or confusion. Stick with me. You're doing more than watching a video. You're investing in yourself. And that matters. Absolutely, Rhiannon. Here's the continued narrator-only script for Tip 4. Be proactive about prostate health. Now let's talk about something that affects millions of men, but often gets brushed aside: your prostate. This small gland plays a big role in both urination and sexual function. And as you age, it tends to grow, sometimes a little, sometimes a lot. That's called benign prostatic hyperplasia, or BPH. It's not cancer, but it can feel like a disruption to your life. You might notice waking up often at night to urinate, a weak stream, dribbling after you think you're done, urgency that feels hard to control. And yes, it can even affect your ability to enjoy intimacy. But here's the truth. BPH is manageable, and it's common. You don't have to be embarrassed. You don't have to wait. Practical tip 1. Limit fluids before bed. Try to reduce fluid intake about 2 hours before bedtime. That means less water, tea, or soup late in the evening, especially diuretics like caffeine or alcohol. This simple change can reduce nighttime trips to the bathroom, helping you sleep better and feel more in control. Practical tip 2. Try pelvic floor exercises. Yes, men too. You've probably heard of Kegels for women, but they're just as effective for men. They strengthen the muscles that control urination and support the prostate. Here's how. 1. Tighten the muscles you'd use to stop urine midstream. 2. Hold for 5 seconds. 3. Relax for 5 seconds. 4. Repeat 10 to 15 times, twice a day. No one can see you do them. You can practice while sitting, driving, even watching TV. Practical tip 3. Talk about a PSA test. The prostate-specific antigen, PSA, test is a simple blood test that helps screen for prostate changes, including potential cancer. I've seen too many men delay this conversation out of fear. But early knowledge is not a sentence. It's power. Ask your doctor, should I have a PSA test based on my age, family history, and symptoms? It's a short question that can save years of worry. Science light, natural supports. Some men find relief using saw palmetto, a plant extract that may reduce symptoms of BPH. Zinc is another nutrient important for prostate health. But remember, natural doesn't always mean safe for everyone. Always speak with your doctor first. You deserve a prostate that doesn't slow you down, disturb your sleep, or interrupt your confidence. Now, let's move into a topic that touches the heart of many men over 60. Intimacy. Because being older doesn't mean giving up closeness. It means redefining it with wisdom, presence, and love. Tip 5. Intimacy is still yours. Let's strip away the myths. Sexuality doesn't disappear with age. It transforms. For many couples, the later years are the most emotionally rich, connected, and intimate. Why? Because the pressure fades. The need to prove something disappears. What's left is presence, tenderness, and honesty. Key point, intimacy isn't just performance. Many men feel shame when things change down there. But real intimacy goes far beyond performance. It's about holding hands longer, talking openly, exploring touch, closeness, and laughter without expectations. Practical tip 1. Communicate honestly. Sit down with your partner. Say, things are changing, but I still want to connect with you. That simple sentence opens doors. Don't assume your partner doesn't care. Many are waiting for you to bring it up. Practical tip 2. Use lubrication. Dryness, whether from aging, medications, or menopause, can cause discomfort for both partners. A good, natural lubricant can restore comfort, reduce pain, and increase enjoyment. Choose products without fragrance or harsh chemicals. Aloe-based or water-based lubricants are often gentler. Practical tip 3. Let go of the clock. Don't rush. Let intimacy be slow. Explore what feels good emotionally and physically without needing to finish in the traditional sense. You're not losing your sexuality, you're refining it. This stage of life can be a time of deeper love, richer connection, and beautiful vulnerability. And if you're single, you still deserve pleasure, touch, and self-compassion. You're not too old. You're still you. Want to see a urologist? You might be wondering, when should I actually see a urologist? My answer? Earlier than you think. Don't wait until something feels broken. A urologist can help you with erectile changes, prostate health, urinary issues, testicular health, and even hormone balance. Watch for these signs: pain or swelling in the testicles, blood in your urine or semen, burning or difficulty urinating, lumps, sores, or persistent itching, erectile issues that last more than a few months. Practical tip: make a list. Before your appointment, write down what you've noticed. Be honest. No one is judging you. We're here to help. And remember, prevention is strength. You're not admitting weakness, you're building wellness. Empowerment and action steps. Let's bring it all together. Here's what we've covered. Know your body. Self-checks give you clarity. Protect your blood flow. Move, hydrate, and eat for circulation. Support your hormones, sleep, strength, and speak up. Keep your skin healthy. Gentle care goes a long way. Stay emotionally and sexually connected. Intimacy evolves, not ends. Prostate matters. Early action means better days. See your urologist. You're never too old to advocate for yourself. This is not about fixing what's broken. This is about honoring the body that carried you through decades of work, love, and life. You are worthy of care. You deserve connection, vitality, and freedom from shame. You're not broken. You are refining. You are not fading. You are focusing. And most of all, you are not alone. You are not alone. If this video helped you, comment below with a 1. If you're still thinking it over, drop a 0. And tell me, what country are you watching from? Because this message is for men everywhere. I read your comments. They shape the next videos. They help others know they're not the only ones navigating this path. Share your story. Subscribe if you haven't already. Tap the bell so you don't miss what's next. Together, we are building a space where older men feel seen, supported, strong, because you are. Thank you for being here. I'm Dr. Jake, and I'll see you in the next one.